For many people, one of the scariest things they have to deal with is opening a mail or an email from a healthcare provider and seeing what portion of the bill they're responsible for and wondering if they're going to be able to pay that bill, or going to the pharmacy to pick up their medications and just waiting for the clerk to tell them how much they have to pay. Many older adults are living on fixed incomes and looking to save on their health care costs. Medicare savings programs and the Extra Help program are designed to do just that. Dr. B from People's Health, Dr. Brent Wallis is joining us now to help us discuss ways people can lower their Medicare costs. Good morning, Dr. B.
Hey, Dave. How are you doing?
I'm doing great. Loving this weather today. Unfortunately, it won't last, but we'll soak it up while we can. First, before we get into these programs that can help people, particularly older Americans, save money on their health care costs, I hear people frequently interchange or mistake Medicare and Medicaid for one another. What are the differences between Medicare and Medicaid?
Yeah, absolutely. It's a good question because it can get very confusing for people. So Medicare is actually a government-funded health insurance program, and so that's a program that really provides health care benefits to people who are ages 65 and up, or it could be people that are younger than 65 that have certain disabilities. And then it also covers people that are any age that have end-stage renal disease. Medicaid is very different. It's actually a joint federal and state program that really helps pay the medical cost for people that are eligible that may have limited income or resources. And keep in mind that Medicaid eligibility is going to vary from state to state.
So can someone have both Medicare and Medicaid?
Yeah, absolutely. Though they're two separate programs, they can really work together to cover your health cost. So Medicaid can help pay for any of the cost sharing that you may have, against your benefits under original Medicare. So things that you get done in a hospital or a skilled nursing facility, things like that. But Medicaid can also cover services that original Medicare does not cover. So that may be things like routine vision coverage or even prescription drug coverage.
So someone who is 65 or older or under 65 with one of the qualifying disabilities, or anyone in end-stage renal disease who is on Medicare, not a bad idea to see if they can also qualify for Medicaid to help cover some of these costs that are often so difficult for people.
Yeah, absolutely. You want to check because if you're covered, it's going to save you a lot of money.
What other services are covered by Medicaid?
So, because Medicaid is a state program, each state is going to be a little bit different. They determine their own program and they determine the services that it's going to cover. But there are some rules. So the feds actually say you have to cover inpatient and outpatient hospital services. They say you have to cover doctor's visits, so the physician services, all labs and x-rays, and then home health services. And then Louisiana Medicaid also covers additional services, things like chemotherapy, visits to your foot doctor, durable medical equipment, that's things like oxygen and wheelchairs, and a lot of other things. But again, that's determined by the state that you live in.
All right. So one way folks on Medicare can help reduce their costs is if they qualify for Medicaid. That can help out. What are some other ways that people who have this anxiety and have limited income and know that they're going to be challenged to pay these bills, how else can they save on their medical costs?
Yeah, so fortunately there are some other programs. So if your income's not low enough, or you may have resources, things like you own houses or other equity, then you may not be eligible for full Medicaid, but you might be eligible to enroll in something called a Medicare savings program. And those programs are actually managed by Medicaid. What they do is they actually help you cover the cost of your Medicare premiums or any of those cost-sharing things like deductibles, coinsurance, and co-payments. And then the other nice thing with the Medicare savings programs is they waive the Medicare Part B late enrollment penalties. So if you don't sign up for Medicare when you're supposed to, you may get a penalty every single month for the rest of your life. So they will help you waive that penalty.
Well, that would actually be helpful, obviously, in saving money. Who's eligible for this Medicare savings program?
Yeah, so this is where it gets a little confusing because there's 4 types of saving programs, and each of them has slightly different benefits and slightly different eligibility requirements. But to be enrolled in any of the programs, you absolutely have to have Medicare Part A, and you do have to meet certain income guidelines. And those income requirements are going to be based on your family size and kind of where your income is and where it hits the federal poverty level. And keep in mind that that level can change from year to year. So your eligibility for a Medicare savings program might also change from year to year. So it can get very confusing. You really have to know what those income limits are, and you can usually find those by going to the Medicaid website.
All right, yeah, and that I think that's one of the biggest challenges with all of this is it's been built over years and years. There's been layers and layers and layers of regulations added, often in an effort to improve the programs and help people, but it does get very confusing, and I guess that's why we need folks like you and organizations like yours to help us kind of navigate all of this.
Yeah, navigate is the correct word, definitely. Sometimes you need somebody to just kind of walk you through it.
And folks can obviously contact People's Health for help doing that.
Absolutely, yeah. We'd take you through all the steps.
All right. Well, we'll get more detailed into some of these options available with Dr. Brent Wallis coming up after we take a look at traffic here on WWL. Trying to help you, your parents and grandparents save some money on overwhelming medical bills. Dr. Brent Wallis at People's Health is our guest, and we've been talking about Medicare savings programs. Dr. B, can you tell us about the different options for Medicare savings programs?
Sure. So like I mentioned before, there's 4 different programs, and this is where it gets a little confusing. So we can help you kind of step through this. The first one is called the Qualified Medicare Beneficiary Program, or we call it QMB, and that covers your Medicare Part A and B premiums, as well as your deductibles, co-payments, and co-insurance. A very good program. The second one is called the Specified Low-Income Medicare Beneficiary Program, or SLIMB, and that actually just covers the Medicare Part B premium. And then there's another one very similar called QI, or the Qualifying Individual Program, that just covers your Part B premiums. And then the last one is called the Qualified Disabled Working Individual Program, or QDWI, and that actually will cover your Part A premiums if you're a working disabled person who's under 65, and maybe you lost your premium-free Part A coverage when you went back to work. So again, it gets very confusing, so you have to talk to somebody about these options.
So if someone thinks they may be eligible for one or several of these money-saving options, how do they apply for a Medicare savings program?
Yeah, so the absolute easiest way is to really go to the Louisiana Medicaid website, so medicaid.la.gov, and there's a big blue button on the screen that says Apply or Renew Medicaid button. So again, even if you don't have Medicaid, that's where you go to apply for these programs. Another good place to go and a good resource is your Council on Aging. They can actually connect you with either a senior health insurance information program or maybe the Aging and Disability Resource Center. They're going to hook you up with a representative that can help you understand these programs a little better.
All right, so some options there. And I didn't hear anything, though, about prescription drug costs. Obviously, that's a big concern for many people. Are there programs to cover those costs?
Yeah, fortunately, and you're absolutely correct. That's one of the biggest costs for people sometimes. And so in addition to these Medicare savings programs, there's also something called the Medicare Extra Help Program. So that is for people who may have low income and limited resources, much like Medicaid, but they don't necessarily qualify for full Medicaid. And that will help you pay your Part D or prescription drug cost premiums, and it can even jump in and help your deductibles and the co-payments as well. And with that program, you either get full coverage or partial extra help. And if you get the full coverage, everything is covered for you. And obviously, partial is only going to cover a part of your premium and maybe lower the cost of your prescription drugs a bit.
All right. So hopefully, yeah, you get some help and then you get some extra help through this program, which is, I guess, why they called it the Extra Help Program. What else does it cover?
Well, the other big thing it covers is much like the Medicare savings programs that waive the Part B penalty if you don't sign up right when you're supposed to. The Extra Help program will also waive the Part D late enrollment penalty, which can be a significant amount of money that you have to pay monthly, for the rest of your life. So if you qualify for Extra Help, you can get out of that late enrollment penalty as well.
All right. How do we know if we're eligible for the Extra Help?
So, fortunately, a lot of people automatically qualify. If you have full Medicaid coverage, you're going to qualify for Extra Help right away. People that receive supplemental security income benefits, they're going to qualify usually. And then if you're in a Medicare savings program, they're going to check to see if you qualify for Extra Help as well. And then the other big group is people who live in nursing homes, or if they would live in a nursing home, but they're actually in a community-based area, then they're probably going to qualify as well. But if you don't automatically qualify, you might still be eligible for Extra Help, but you have to apply for it.
All right, and you apply at the same website you would for the other program we talked about before, right?
This one's actually a little different, unfortunately. You actually have to go to the Social Security office, or you can do it online via the Social Security Administration website. So that's ssa.gov. But again, one of the best resources you can use is your local council on aging, because they're going to make sure you get to the right person who can talk to you about all of these programs and get you signed up for the right thing.
And of course, People's Health can help them as well. How do they get a hold of you?
Yeah, absolutely. All this information's on our website at peopleshealth.com, or we invite people to come and visit us actually in our Medicare Center, which is right on Veterans next to Party City. You can sit down and talk with somebody and go through this really confusing set of programs, but it really can help you save some money.
Dr. B, thank you for telling us about all these cost-saving options for people who desperately need the assistance, and we know that they'll be coming to you to try and figure out and navigate all of this. We'll talk to you next week. Thanks for joining us here on WWL.
Thanks, Dave. Have a great weekend.
I'm Dave Cohen in for Tommy Tucker. After the news, we've got Ton Trung coming in here on WWL. Now it's Ian Ozan.